Hello, listeners. Welcome back to the Glam Report, where we explore the science and innovation shaping the future of aesthetics and wellness. I'm your host, Amy Harrington, and today we have an extra cool episode lined up for you. Literally. Our guest is none other than Kristine Tatsutani, the Chief Science Officer, cryobiologist, and one of the brilliant minds behind Glacial Skin. Kristine is a trailblazer in the world of cold science, and she's here to share her incredible journey and passion for harnessing the power of cold to transform the world of aesthetics. We'll dive into the fascinating history of cold in medicine and wellness, learn how it's being harnessed today to treat the root causes of aging, and discover why cold therapy is at the forefront of the future of aesthetics. Kristine also shares how Glacial Skin stands out in a sea of other cryo devices, and why cold therapy deserves a place in everyone's life. So grab a cozy blanket. It might get cold in here. Let's get into it. Hello again, listeners. Today we are joined by a very exciting guest, a scientist, mom, cryobiologist, and an animal lover, and our very own, very adored Chief Scientific Officer here at R2 Technologies, Kristine Tatsutani. Kristine, thank you so much for joining us.
Thank you so much for having me.
I'm so excited to get into the cold facts that is the topic of our conversation today. We have a device here at Glacial Skin that uses cold as its primary mechanism of action, but out in the world today, we hear about cold being used in so many different ways. And there's a history behind the use of cold in medicine with physicians that goes really far back. And so I'd love to talk to you today and learn a little bit more about not only how did you get involved with cold science, but also how far does it go back? What does it treat? Why is there such a trend in today's world with treating cold for inflammation and wellness? So again, welcome. And tell me, let's start with you. Let's start with, how did you get started in cold? How did you become a cryobiologist? That is so interesting.
It's not something you wake up when you're 5 years old and decide, I want to become a cryobiologist.
Exactly.
So my journey into cryobiology and cold medicine really started 30 years ago when I was studying breast and prostate cancer treatments using cryosurgical methods. And so that was for my doctoral dissertation. And since that time, I have spent the next 3 decades working on this whole variety of different cold technologies to treat medical indications and applications as diverse as interventional cardiology to electrophysiology, critical care, ear, nose, and throat surgeries, pain management, really a whole wide range of different medical disciplines. And of course, I spent the last 15 years now really focused in the field of aesthetic medicine.
Was that journey intentional, or was it something that you just kind of stumbled upon?
Most things in life, I think you stumble upon, and I think that's true here as well. I think that, there were definitely some things that happened along the way that inspired my interest and that kept me engaged in this field. I think the world of cryobiology is really fascinating, and it's a world that's really evolving. We've had such a growth in the technology, such advancement that we're able to do things now that were really not something we could consider previously. And it's really expanded the universe of what cold can be used for in medicine. And then, of course, getting to interact with some scientific minds like, Roxy Anderson and Henry Chan and Dieter Manstein has also, really inspired my journey.
I'm sure. So working with pioneers like Rox and Dieter and Henry, how has that inspired you?
So, I think everyone knows these 3 gentlemen as being, such prolific and creative innovators and inventors. And but the thing that really inspires me about each of them and the commonality that I find between them is that they are each just endlessly curious about how things work. And they have this really uncanny ability to take what they learn about how things work and connect that understanding to solutions for in medicine and just for unmet needs. And I think that that enthusiasm, that curiosity is just it's really inspiring. And so after working on the cool sculpting device, I just jumped at the chance to get involved with them on another technology, and that's what brought me to R2 and to the Glacial Skin family about 10 years ago.
So, speaking of history, how has cold historically been used in medicine?
So cold has a really, really long history in medicine. I think Rox once said it's as old as dirt. It dates back to ancient times. In ancient Egypt, they documented the use of cold compresses and ice to treat injuries and to reduce inflammation. And there was a very, very long period of time when cold was used very routinely for some of these, with some of these very primitive methods, even for palliation of tumors. However, in the modern age, as I said, we've had such an explosion of technology, of technological advancements, that have allowed us to gain some really fine control over the delivery of cold and what kind of conditions tissue is exposed to. And that has really opened the doors to deliver very targeted and selective effects on tissue that really exceed what any of the predecessors were able to do.
Yeah, I've been so impressed learning about cold and how many different indications it can, we were speaking earlier about how sometimes cold can be used for treating tissue in a good way, but sometimes also,
Yeah.
can you expand on that a little bit?
Yeah, absolutely. And I think this is what's made it interesting for me to be in this field for 30 years. Cold is really unique because it has used one way. Cold temperatures can destroy tissue. Used another way, they can preserve tissue. Used yet another way, cold temperatures can heal tissue. And so it's finding those selective effects. In the range of really extreme low temperatures, we have cryosurgical techniques where the intention is to freeze tissue and to ablate that tissue. It's used for all kinds of cancers. I mentioned, breast and prostate cancer, but it's used for a variety of things, creating lesions, cardiac lesions, to stop cardiac arrhythmias, for example. Uh, those exact same temperatures can actually also be applied to preserve tissue. And you have to, of course, cool the tissue in a very different way. But that's been an incredible advancement that's allowed us to develop methods to preserve organs, to preserve cells, to preserve tissues for organ transplantation, for research. I mean, that's become a really, vital component of our medical, approach to different kinds of conditions. There is this sort of third use of cold, which generally doesn't use freezing temperatures, where you're actually able to just modulate tissue biology and tissue processes. And I think that's where most of my career has been focused. And I think that's where the glacial platform really offers some incredible opportunities, because we find we're able to modulate things like inflammation and pain, and do so without creating permanent changes in tissue.
So it's very interesting to me to hear about all of these like very sciency and very medical uses and life-saving. I mean, I know as a former operating room nurse, when we have emergency response, you're trying to cool the patient or keep them cold for organ preservation. But to go from something that's that, life-saving and medical to what the latest trends that we've been seeing on social media, like ice plunges for your face and ice plunges for your whole body, ice baths. People do ice baths regularly. Tell me a little bit about how kind of that whole journey has transpired with cold and why you think that today, the general public is using cold as a wellness tool.
Yeah, and I think this is really interesting because there has been this real resurgence of interest, in wellness and also in the field of aesthetics. Resurgence of interest in the use of cold. I think that when you think about wellness therapies, there's a real that are non-destructive, non-injurious, and and cold really delivers on that. Cold is a way to just modulate some of the immune responses in the body. It can also, I mean, it can create this whole host of physiological responses. It can boost the immune system. It can alter. It can alter mood. It can be used to address, muscle and tissue recovery after injuries. It can be used to promote better sleep. There's just this incredible array of different uses for cold that all sort of live in that space of improved health and wellness.
But what is actually happening? So let's just say, that pro athlete that's going to plunge into a bath of ice water. What is actually happening in the body that is helping that muscle recovery?
Yeah. And so, again, it's a really multifactorial process. So if you're treating someone with cold for muscle recovery, the intention there is to really bring down edema and bring down inflammation. And so the one of the very well known and well established impacts of cold is to cause blood vessels to constrict. So it causes vasoconstriction. And what that does is it limits the influx of inflammatory bodies into the tissue. It also reduces edema or swelling in the tissue, and then it also mitigates pain because cold is known to reduce nerve conduction velocities, and in doing so, it provides a sort of analgesic effect.
I've heard of cold having mental health wellness benefits. I've heard of cold having immune benefits. How do those kind of non-specific benefits actually happen? Like, what do you think's happening with cold, and
Yeah.
why do we claim those benefits?
Um, So one of the really interesting things that cold does to the body is it actually activates the parasympathetic nervous system. And so to explain that, the nervous system is split into the sympathetic side. The sympathetic nervous system is responsible for your fight or flight impulse. So that's important to help you react appropriately to danger. Increases heart rate, releases cortisol, all the things that happen when you're in danger. And then the parasympathetic nervous system is the counterbalance to that. So that's what tells your body to rest and relax. Cold is actually known to activate the parasympathetic nervous system. And in particular, cold applied to the head and to the neck activates the vagus nerve. The vagus nerve, which is part of your parasympathetic nervous system, tells your body to relax. It actually reduces your heart rate, it reduces your respiration rate, lowers cortisol level, releases dopamines, and all of these elements, lead to better, over time, to better vagal nerve tone, and that's something that helps to balance your mood, to manage your hormone, your cortisol levels, and so that's how I think cold plunges have become sort of one of the pieces of a wellness regimen.
Yeah, that makes total sense. Our aesthetic providers, oftentimes massage providers, aesthetic providers, they are taught to stimulate the vagus nerve
Mhm.
because that does release all of those wellness benefits from a chemical standpoint in the body. That stimulation is actually proven because the vagus nerve is communicating with all of our major organs. It's like exactly what you said. It has all of these biological responses where it is controlling the heart rate and the blood pressure and your digestive enzymes and all of that. So it's really like whole body wellness, wouldn't you say?
Absolutely, absolutely. I think that this is something that's becoming better understood now. The relationship of our nervous system to all the other functions in our body is something that's really been, one of the the movements in medicine and in wellness is just to understand the relationship between all of these different systems. And so, yeah, cold is able to actually activate that part of the nervous system that is responsible for rest and digestion and relaxation. Cold has also been shown to actually boost immune response. So, for reasons that are perhaps not entirely understood, it can increase white blood cell production. It can improve antioxidant defense mechanisms. And so there are ways in which it's been shown that cold exposure can actually improve immune function. Another reason I think that, cold has sort of entered into that wellness armamentarium.
It's so interesting. So being a cryobiologist and understanding all of this, Kristine, do you cold plunge?
I absolutely do not. And I think there's the other trend, particularly in aesthetic medicine, is that people are looking for pleasant experiences. And I personally don't enjoy the cold plunge. But I think that, there are ways to apply cold a little bit more elegantly to the body that are really pleasant. And so, I think, for example, with the glacial skin treatments, these are treatments, I've had them myself. They're extremely luxurious. They're relaxing, they're enjoyable. You don't want them to be over. You're not, counting the seconds in the cold tub. And so I think that just presents a much better option to get that parasympathetic activation.
I definitely agree with you. In fact, I have seen myself in clinical setting, patients don't want the treatment to end. In fact, I've even seen some patients snoring in the middle of their treatment. So it is the opposite experience and journey to sitting in a bath of cold ice water.
Yeah.
So we've talked a little bit about the vagus nerve and how that has all of these amazing benefits for the body, and this is why people do cold plunges and things like that. And then you also kind of mentioned this pleasant experience with the glacial skin device. I'd love to tie those two things together. So can you actually stimulate the vagus nerve and get wellness benefits from getting a glacial skin treatment?
So it's certainly, it's really interesting because the way they found this vagal reaction was in studying divers. And they found that when divers would go into the water, that their heart rate would drop, the respiration rate would drop. So all of these different physiological reactions would happen. And then when they studied it further, they found that they could get the same effect just by putting the face and the neck in cold water. So when someone tells you, to calm down, go in the bathroom and splash cold water on your face, it actually works.
There's actually science
There's
behind
actually
that.
real science there. And so, when a glacial treatment is being delivered to the face and neck, you're really, you're delivering exactly the right treatment in the right part of the body to activate that important vagus nerve, and to bring about that parasympathetic activation.
Yeah, that whole diver's response is very
Really
interesting how
interesting.
they stumbled upon
Yeah.
that. So, we haven't talked too much about inflammation, but I know that one of the pillars and one of the, mm, the reasons why people get glacial skin treatments is because it downregulates inflammation. So tell me a little bit about the mechanism of how delivering an aesthetic treatment, a cold aesthetic treatment can actually downregulate inflammation. And then from there, how are we incorporating that into inflammatory skin condition treatments?
Yeah, absolutely. So, before I leave the vagus nerve, vagal nerve activation has actually been shown to reduce inflammation. It actually produces an anti-inflammatory reflex in the body. So, that is actually one of the pathways to reducing inflammation using cold. There are many other pathways. We talked about how cold constricts blood vessels and how that limits the infiltration of inflammatory bodies into the tissue. When we deliver cold in the skin, we've also seen scientifically that there is an increase in the number of anti-inflammatory cytokines and a decrease in the number of pro-inflammatory cytokines. So to kind of break that down, cytokines are signaling molecules. They're the way that they're the messenger that the body uses to tell surrounding tissue when an inflammatory process should be underway. So when you have an injury and an infection, the cytokine is the messenger that turns the inflammatory process on and keeps it going. Of course, when you have inflammation that's present chronically in the tissue, those cytokines are chronically, activated and are delivering an improper signal to keep inflammation going. Cold has been shown to reduce those pro-inflammatory cytokines, and at the same time, it's also been shown to increase the number of anti-inflammatory cytokines. So the messengers that tell you to stop having the inflammation, it increases the numbers of those. So those are some of the mechanisms. We also talked about how it affects nerve conduction. So by reducing pain signaling in the tissue, you're also reducing, taking away yet another driver of inflammation. So those are, some of the ways in which we know that cold affects inflammation in the body. In terms of how that is useful in skin, I mean, the sky is the limit. This is where, to me, it's still exciting to be working on this. Some 30 years later. Um, what we've really learned is that inflammation is at the root of virtually every known, medical condition, chronic medical condition, and certainly that's true in the skin. We think about all the chronic conditions like, acne, rosacea, psoriasis, eczema. A lot of these conditions were not really seen as inflammatory conditions in the past. Acne is a good example. It was seen as an issue of, the sebaceous gland.
Right.
Really, at this point, it's been identified as another inflammatory condition, and inflammation plays this very pivotal role in that condition. And so, if we can reduce inflammation in the tissue, we can address symptoms of some of these inflammatory conditions and help to manage the condition. Um, the other really fascinating piece of what inflammation does is it just sort of generally degrades the body. When we uh, talk about skin, we have this term skinflammation. I've heard other people call it inflammaging because it is actually aging the skin. And so we've learned that the environmental stressors that we're exposed to, sun exposure, pollution, some of the stress and poor diet and smoking, poor sleep, etc. All of these things cause low levels of inflammation in the body and in the skin. And over time, that actually causes cellular degradation in the skin, and it leads to an acceleration of all the aging processes. So all the cosmetic signs of aging, formation of fine lines and wrinkles, skin laxity, sort of poor skin tone or uneven skin tone, dullness and dryness of the skin, all of these things are really driven by that inflammatory process. So again, I think this is another place where we've learned that we can use cold to to slow down those processes and to bring about some cosmetic benefits, as well as helping patients that have some of these inflammatory skin conditions.
Yeah, it's inflammation has become a really significant part of the conversation in aesthetics.
Yeah.
I've been in aesthetics for over a decade, and we used to treat always with heat. That was really, I think, the primary tool in the clinician's toolbox. And it's really interesting to be part of this journey where we're seeing this shift in our thinking about, we're not necessarily treating what you see, we're treating the cause of what you see.
Yeah.
And I just think that it's such a more comprehensive solution to the problem.
Yeah.
I was listening myself to a podcast recently, and they said, we're treating the symptoms of inflammation. In all of these cosmetic procedures, we're treating the symptoms of the inflammation.
Yeah.
But inflammation is the root cause of all of it. And I really think it's a shift in our industry on how to think about skin aging, aesthetic, what we're treating in the aesthetic realm, everything that you just talked about, the fine lines and wrinkles, the uneven skin tone. If you think about just one of those things, uneven skin tone, it's usually skin cell turnover cycle slowing. It's the melanocyte overproducing melanin. You think about fine lines and wrinkles, it's the dermis losing its elasticity and its collagen. And all of the degradation of everything that I just mentioned, that degradation starts with the trigger of inflammation. So let's talk a little bit about chronic inflammation versus acute inflammation.
Yeah.
So inflammation is not always bad, right? I mean, our inflammatory process in our body is keeping us alive.
Absolutely.
Because if we got the flu or we sprained our ankle or had a sore throat, our body's response and sending out those signaling molecules of everything you were just talking about, the signaling molecules of the alarm system our body is sending out, those pro-inflammatory cytokines, that is our body's repair system. So inflammation is good. But at what point does it become bad?
Yeah, and that's, understanding the body's mechanism for turning these things on and off. I think, it's going to be, that's something that lots and lots of people are studying. It's bad when it's no longer necessary. It's bad when it becomes, when the inflammation is too severe, or when it becomes persistent, and it can become a sort of self-reinforcing cycle. And we see that as an underlying cause of, everything from cardiovascular disease to neurodegenerative diseases like Alzheimer's, autoimmune diseases like rheumatoid arthritis, diabetes. It's inflammation is sort of a culprit behind so many of these long-term chronic diseases, where the immune system has just entered into this sort of self-reinforcing inflammatory
Mm.
cycle, and nothing is breaking that cycle.
I like to call it the hamster that can't get off the wheel. If once you that chronic inflammation, it just doesn't stop, and the
Yeah.
body just keeps on signaling that inflammation to continue.
Hmm.
So besides cold, what are some other things that, listeners, if they're interested in inflammation and trying to manage inflammation in our inflammatory world,
Yeah.
what are some other things like generally that people can do about inflammatory
Yeah.
processes?
I mean, I think, for general inflammatory processes in the body, obviously, all of the lifestyle stuff. The diet is incredibly important. Sleep, stress,
Mm,
avoiding stress, good hydration. These are all things that are, really the best way to go after inflammation. In the skin, I think the key is really sun avoidance or sun protection. UV radiation is the greatest cause of premature aging and inflammation. So I think that's the very, very first thing to do is put on lots of sunscreen when you go outside.
mm,
But then all of the other things that I just said, good sleep, good hydration, good diet, those are all the other things that we can control, that really help to avoid those chronic inflammatory processes. In some cases, though, where patients develop these disease states like psoriasis or eczema, this is in those cases, of course, those are not really necessarily being driven by the
mm.
environmental triggers. Those are, you really have a systemic issue. Um, and so in that case, anything you can do to reduce that inflammation and to kind of blunt those symptoms, I think is helpful.
Right. It makes sense. So, I mentioned earlier that, early in my career, I was working with mostly heat-based
Yeah,
devices
yeah.
to achieve aesthetic results and
Hmm.
cosmetic benefits in this industry. And we're now seeing this trend towards using cold to treat to prevent and
Hmm.
treat
Hmm.
those signs of aging. Oftentimes in the laser world where I came from, I often heard, you want the inflammation, you want
Hmm.
the inflammation, you want to show the heat shock proteins to
Hmm.
validate that you've achieved a clinical endpoint, or
Yeah.
a clinical result that's going to have a clinical endpoint. Um, I get the question all the time, like, don't we want that inflammation? And why are
Mhm.
you trying to extract the heat so it doesn't cause the inflammation? Can you expand a little bit about, why we know that using cold post laser and post heat based device is actually beneficial and not harmful?
Yeah, absolutely. And this is, um, it is a question that I've heard several times. I think the way to look at this is that, these lasers and heat-based devices typically they work on an injury mechanism. You're creating an injury in the skin. Often you're trying to promote neocollagenesis or, new collagen formation. And you're relying on that injury to drive that process. However, the injury is delivered to the skin at the time that you deliver that laser energy. So, you're delivering a level of energy that's going to create some small ablation zone in the tissue. That injury is in place. Now, after that injury is in place, the body is going to heal that injury. It's going to have some amount of inflammation as part of that healing reaction. But there's what Rox calls, the good inflammation and then the bad inflammation. And uh, what you don't need is excessive inflammation. That can actually work against the healing process. And so by delivering cold right after a laser treatment, you're actually just helping to suppress that excessive inflammation and help that tissue to recover faster. And we actually have clinical studies that have been published, where the uh, investigator reported that in fact that they thought that the not only was recovery improved and patient satisfaction was improved, but that the laser outcomes were not diminished by the delivery of cold right after
Yeah.
right after.
Well, and I'm sure am sure that the patient retention improves when you deliver
Absolutely.
a very
Nice, pleasant,
yes,
pain
exactly.
relieving treatment. Yeah. And I do think that that's why cold has really entered the conversation as it has, because you're right, heat-based devices have really dominated the aesthetic space for a long time, and they're very effective in bringing about these changes in tissue. But again, I think that, with cold, the appeal is really you're introducing technology, or you're introducing a method that is not injurious, that is actually restorative. And you're also able to provide a treatment that has clinical benefit without being painful.
Yeah, I'm just curious about how that shift happened in our field. I mean, I don't know if you know the answer to this, but what is that shift? Like, how did we shift from heat to, I've even heard a lot of, podcasts and people in the field, very, reputable people in the field say that they don't actually want to treat with heat-based devices anymore because of the residual damage that
Yeah.
they can be doing. So what do you think has been the category creator? What is the game changer? Is it Glacial Skin? Are we the category changer?
I think there's been this movement just towards just achieving healthier skin.
Hmm.
And I think the glacial skin is part of that movement. But the movement towards healthier skin, I think that that's been sort of a rising tide for some time now. I think that, the focus, when lasers were introduced, the focus was probably more, as you said, on just treating symptoms.
Right.
When a patient had developed significant skin laxity or wrinkles, to try to go after those signs of aging. I think now the tendency is for patients to want to address these issues before they really become problems, and patients have a better understanding that the best way to do that is to achieve good skin health,
Hmm.
um, and that trying to do that using natural means, using means that are not working through an injury mechanism, but rather through a mechanism that actually enhances skin health. I think that that's become uh, more on trend.
Yes, I agree. I mean, I think when I got involved in this, I've heard more than one person, more than one clinician say, "No pain, no gain."
Hmm.
That was kind of
That was the
our
motto, yeah.
that was the motto exactly. It was like you have to feel the pain in order to get the result, or
And
I
you have to
want
have
to.
side effects.
Right. I want to see, I remember a lot of
Yeah,
patients even saying, I want to see the bruising so that I
yeah.
know something is happening. But I really sincerely think that there's been a
That
shift,
mindset
that
is
mindset. So
critical.
our patient demographic and the perspective and mindset, I think in our patients has changed. And it could be just an overall, to your point, it's just this overall wellness and maintenance
Hmm.
and prevention
Hmm.
versus I'm going to let it all the damage happen
Yeah,
and then I'm just going to treat it after.
exactly. Yeah.
Yeah.
And of course, all the technology is part of that movement, because without some of the technological advancements that have allowed us to create devices that will provide that kind of really fine control. We talked earlier about how cold can destroy, it can preserve, it can heal, it can stop pain, it can do this incredibly wide array of things. The only way to really direct what that cold is going to do is if you have that really fine level of control over your cooling conditions. And so I think that the availability now of technologies like glacial skin or it are what have opened the door to us being able to access that as a solution, and as an alternative to some of these other older technologies.
Yeah. So, how would you say that the glacial skin treatments and devices differ from other cryo devices on the market?
Yeah, so there certainly has been, cryo's been in the world for a long time, and cryo's been in dermatology for a long, long time. So with the glacial skin technologies, I think that the biggest and most important differentiator is that they do provide very, very precise and very controlled cooling. If we look at some of the other devices that have historically been used, many of these are cold air or cold spray devices. These are devices that have very poor thermal efficiency, and so they require very, very cold air, sometimes as cold as negative 80 degrees Celsius, cryogens that can cool the skin, because air is a very poor heat transfer medium. And because of that, it creates a risk of inadvertent freezing. It becomes a very user-dependent technique. And so there are some fundamental limitations with some of those with the cold spray devices. Of course, we've got the really old primitive means like ice packs or gel packs or cryo
I
globes.
hear that a lot. Say, why can't I just use my cryo globes?
Yeah. And, I mean, truthfully, cryo globes, they feel lovely. And if you have them in your freezer, there's absolutely no harm in using them. They feel very nice. But they really they don't allow you to actively extract heat. They sit in the freezer, you take them out, you apply them to the skin, and they warm up as you use them. There's no active control of tissue. There's no active extraction of heat. So it's they're nice to use, but they don't really deliver clinically therapeutic benefits.
Is there any time that you can't use the Glacial Skin device? Is there any patient type or any, modality that you can't use it with, or is there any limitations to how you can use the cold device?
That's a good question. I'd say there's one limitation really. There are a few patients out there that actually are allergic to cold.
Yeah, that's
and
so
this would
interesting.
not work well on a patient who's allergic to cold. But with the exception of those fairly rare cases, the treatments, the glacial skin treatments, are really incredibly versatile. And there's so many different ways to apply the cooling and to apply these treatments so that they, will address the needs of specific patients. And so it would be hard for me to identify outside of that very small group of people that is actually allergic to cold or has some other kind of, cold sensitivity. It would be hard for me to put my finger on who wouldn't be a good candidate.
Well, let me throw some out there for you.
Okay.
And you answer for me.
Okay.
How about like post radiofrequency microneedling?
We've seen lots and lots of glacial skin treatments done after RF microneedling, and then it's been nothing but positive reports from that. So there's no reason whatsoever to think that that should be contraindicated or excluded.
How about lasers, ablative and non-ablative?
Again, we've got very, very some of the luminaries in dermatology that have reported on exactly that use and have shown that in fact the glacial skin treatments really benefit those patients after treatment, and that does not appear to create any decrement in their outcome.
Right. So I know you touched on this again, but if you could tell me again, like what are some of those benefits? Like if a patient is getting a laser treatment, why would they want to have a glacial treatment after the laser treatment?
Well, so I'm afraid of pain, so I've not had a lot of laser treatments myself. But I understand that, depending on the type of treatment you've received, there is typically some amount of pain, swelling, sometimes a feeling of heat in the face, certainly redness, and that in the days post-treatment, depending on, the type of laser treatment that you've had, there are side effects. There can be there's swelling, there's redness. In some cases, there can be crusting or other, more severe side effects. And, this treatment will help with all of those side effects. So I think that, the most immediate thing, of course, is a reduction in pain. I think that, to have that heat removed from the face right away and for the patient to be able to walk out of the clinic without that feeling, must be terribly soothing.
Well, I am not like you, and I have partaken in many laser treatments because I was able to. And I can tell you that I would have loved to have a glacial glide treatment after a laser treatment. And when you're feeling that extreme heat that's all trapped in your skin after laser treatments, I would love to experience that with a glacial glide treatment. It would be a much more preferable experience, that's for sure.
It was interesting because we actually, surveyed a large group of patients that received those glacial skin treatments after laser treatments, and uniformly 100% of them said that they preferred the treatment with the addition of that cooling step.
Who wouldn't?
And that they and responded that they would only receive another one of those heat treatments if they could have the glacial treatment afterwards. So it's certainly,
I can't blame them there.
yeah.
So, are there any other indications or applications that can people receive glacial skin treatments on other body parts, on the neck, the décolleté, on joints? Like, are there any other indications?
Yeah, absolutely. There's, so there's really, no place on the body that you couldn't treat. We do have physicians that are using it for musculoskeletal injuries, and so they're applying it to, elbows, knees, joints, um, any place that has any kind of, muscle pain. We have physicians that are applying it post surgery. So, if they've received blepharoplasties or abdominoplasties, surgical incision sites are being treated. Post-surgical treatment has been used, I think, very effectively to reduce swelling and to reduce pain. There's a belief that perhaps it might also offset scar formation because that scarring, of course, is driven by the inflammatory process. I'd say really anywhere on the skin where on the body where you have inflammation, you could treat with this technology. And I can't think of a part of the body that you don't have inflammation. So
Fair enough. I've also seen a lot of social media posts with a lot of clinicians pairing this not only with other technologies, like I see a lot of the post laser, the microneedling, also with dermaplaning, within a facial, like even with hydrofacial, just because there can be inflammation and redness present. So you want to make sure that you're down regulating that inflammation after any kind of treatment.
yeah.
But I've also seen a lot of clinicians posting about different types of products they're using with the device. Can you share with us a little bit about what type of, like, why are we pairing topicals and where does that play in the glacial skin treatments?
Yeah. Well, I think that, with topicals, that just presents a great opportunity. We know that, there's some good topicals that have really, in some cases, potent anti-inflammatory or antioxidant ingredients. And, so the ability to have some synergistic effect with some of these topicals is really, it opens, a whole new avenue for us. And I think it also gives the provider, the clinicians, a lot of flexibility because every clinician, I think, has their own set of favorites. The topicals that they most like to use, and so there's. I don't know that there's anything you couldn't use in conjunction with the glacial skin treatments. And I think that, again, it's another opportunity to customize, to use topicals that might be more appropriate for a patient with oily skin or with acne prone skin versus a patient that has, very dry skin. Um,
Yeah, I could see that as a really great opportunity for a clinician to customize.
Mhm.
So you're treating that underlying, root cause of inflammation, but then you're also pairing it with whatever potent active topicals that you're customizing for whatever patient's skin concerns. So you're
Absolutely.
treating inside out. So you're treating the inside with that modulation, that change, that cryomodulation, changing the skin with cold, and then you're treating the outside in with the active topicals and those
Mhm.
benefits of really great ingredients like those antioxidants and the anti-inflammatory ingredients and things like that. It really is a great combination,
Yeah.
and such a versatile tool that
Mhm.
you can. I guess in a practice you could be generating a lot of revenue because of its versatility.
Right.
Yeah,
Yeah.
Kristine, it's so evident that you have a passion for cold and the benefits of what cold offers patients today. You talked about how you kind of stumbled onto this cold journey in your career. Do you think that your journey with cold ends your career? Are you staying in science of cold?
I think as long as someone will let me keep digging around in this space, I will keep doing it. I think, like I said, I think it's when I joined R2 10 years ago, I never would have imagined where we are today in terms of all the things we've learned, in terms of all the uses that we've discovered. And, what keeps me, getting up to do this every day is that I think that there's so much more. We're just, looking at the tip of the iceberg now.
No pun intended.
No pun intended. Well, that was actually, I didn't even intend that one. But, I think that there's just so much more that we can learn and we can do. And I think, I'm not sure that there's an end to, that there's an end in sight for me.
No,
And that's great news.
and I agree with you. I think that the science of cold and the benefits that it offers us is just beginning. And as always, every time I talk to you, I learn something. You are a brilliant mind, and I feel honored that I got to pick your brain, so to speak, today. So thank you so much for talking with me.
My pleasure.
Yeah.
All right.
And that's a wrap for today's episode of The Glam Report. A huge thank you to Kristine Tatsutani for joining us and sharing her wealth of knowledge about the power of cold, past, present, and future. From its historical roots to cutting-edge applications in aesthetics, we've truly been chilled and thrilled by everything Kristine has had to say. A special shout out to the groundbreaking study work done by Doctors Paul Friedman and Taryn Murray, which continues to pave the way for future advancements in skincare and wellness. If you're as inspired as I am to incorporate the benefits of cold into your skincare or wellness routine, or just want to know more about the exciting research and work happening at Glacial Skin, be sure to follow Glacial Skin on social media. Thank you all for listening. Don't forget to subscribe, leave us a review, send to a friend, and tune in next time for another glamorous deep dive into the world of beauty and innovation. Until then, stay glowing and maybe a little frosty.